a talk with a professional. My name is Hassan Al-Muzan, and I will be your host today. Please let me remind you that this program, Talk with a Professional, is being sponsored by the Virtual and Basic Learning Committee at the Islamic Association of Greater Memphis. My guest today is Sally Mansour. Sally obtained her doctorate from University of Tennessee Health Science Center in 2020. She went to do her first year of residency at the Children's Hospital of the King's Daughters in Norfolk, Virginia. She's currently a second-year pharmacy resident at the University of Chicago Medicine. Her interest is in pediatric hematology, oncology, in which she hopes to obtain a position as a clinical specialist after finishing her training. Sally, welcome in Talk with a Professional.
Thank you. Thank you so much for having me.
So Sally, help our viewers learn about how to become a PharmD. But before we go there, take us back to your high school. When you were in high school, what was Sally Mansour in her mind? What was her plan for the future?
So in high school, I feel like I always had an idea of wanting to be in the medical field, but not exactly sure where. So in high school, I was a part of organizations such as HOSA, which would prepare you for being in the medical school, in the medical field in the future, and so that was my general idea, was I wanted to go into the medical field, but I'm not sure where. Did I want it to be a physician? Did I want to be a nurse? Did I want to be a pharmacist? Wasn't really sure. So I was still kind of getting a field, but prepping myself for being in the medical field.
So then, when you decided, fine, I'm not sure if I want to do pharmacist or become a doctor or a dentist or a nurse, but you felt I want to be in the medical field, right? I want to be a professional in the medical field.
For sure. How
did this affect your selection of college?
So for college, I feel like maybe my experience was a little bit different. I knew I wanted to stay in Memphis. So that was, my options were limited. You have Rose, you have University of Memphis, you have options. But honestly, for me, I guess how I was mentored through that process was, as long as you do well in school and you do your prereqs, and you get good grades and you excel, where you go long-term, where you apply for, whether it's, medical school, pharmacy school, dental school, it doesn't affect as much where you went than it does what your performance during school was. So when applying to colleges, it wasn't as much of a where do I need to go? It was how well do I need to excel? When it came to pharmacy school, that was a different topic, though.
So that's why we want to shed some light on and help parents. Because remember, the idea here behind our program is to advise the kids in high school and also in college and parents. How should they steer and help their kids navigate for the future career? So looking back now, Sally, at your undergrad, if you were to choose again, what would you do differently?
Honestly, I would exactly what I did, I feel like was my best option. I went to University of Memphis. I had full scholarships, so I did not have to pay a penny for University of Memphis, and I got a good education. Education is what you make it. If you want to be a good student, you are going to excel, whether you go to a community college or whether you go to a top elite school. It doesn't matter where you go. It just matters where your mindset is. And I think that's really important in undergrad. I feel like in grad school, you should be a little bit more selective, but as far as undergraduate studies, I feel like it's pretty standard across the board. So it just matters that you are a good student yourself, and it doesn't matter where you really go, is what my experience and what my advice is. So I'm glad I went to University of Memphis. My college was all paid for through my, scholarships. And so when I got to pharmacy school, I didn't have to worry about anything for my undergraduate, because alhamdulillah, it was all already taken care of.
This is wonderful. This is
Yeah.
great and wonderful. So we want to encourage the kids, please study hard
Yeah.
and try to get a scholarship, right?
For sure.
Because it's going to help you move into the future when you are debt-free. A lot of relief. So Sally, congratulations, Sally. This is wonderful.
Pharmacy school is a different subject, though.
I know. We're gonna get to pharmacy school, but first we want them to be cognizant of achieving good grades, so they can get some kind of support during college, right? Now,
sure.
my question to you, Sally, the field. I mean, you. Where did you decide to go to pharmacy, and what do you think is the proper background in your mind to study the field of pharmacy?
Yeah. So I think for me, the revelation came that I wanted to pursue pharmacy. I think it was my beginning of my sophomore year of college. And it was kind of fate. I mean, I was, thinking about, okay, I think I want to do pharmacy. And then I actually met a pharmacist, and very coincidentally didn't know she was a pharmacist. And she just asked me like what I wanted to do, what I wanted to pursue. And I said, I think I want to do pharmacy, but I'm not 100% sure. And she said, well, I'm a pharmacist. So if you would like to at least, see what it's like in the retail setting, I can definitely get you a job, or if you just want to come shadow, it's, whatever you would like. And I was like, okay. So I, took that opportunity, and I got a job as a pharmacy technician at the time. And, I went down that path, and I really loved it. And so that's how I ended up choosing pharmacy. Now, what was your next question? I'm sorry.
So was this the first or second year in college?
This was my second year in college.
So you still probably undecided during the first year, right?
Yeah.
And other field. And then the
Right.
second year, you met the pharmacist. She encouraged you to come and visit her, right?
Mm-hmm.
So you would encourage parents and kids to go outside,
Mm-hmm.
meet people, meet professionals, right? Talk to a doctor, talk to a nurse, talk to a pharmacist, right? Meet people in the field so you can get a better idea what suits you as a person for the future. Because each medical field is different, totally different.
Oh, absolutely. And I feel like you won't actually know what it's like or what you really want to pursue until you see it. So, for example, once upon a time, I shadowed a lawyer, and then I was like, I do not like this. I feel like really getting your feet wet, networking with people is extremely important. Whether
we want to tell all lawyers, don't feel bad, okay? Don't feel bad.
Oh, I have respect for people who go into law. It's just not my passion, but I'm glad there are people out there who love it and who are good at it. But I definitely think networking, meeting people, shadowing, take all the opportunities you can, because you never know where those opportunities will take you, and you might find something that you love that you didn't know you loved. So I really think finding those opportunities, meeting those people is extremely important.
Yes, thank you. Great advice. So you met with this pharmacist. Was she a community pharmacist?
She was a community pharmacist. She worked at Kroger. And so she got me a job at Kroger at that time. And that's kind of, that was my path that led me to where I am now.
Okay. So obviously something triggered, right? When you shadowed the pharmacist at community pharmacy. Share with us, what was the connection for you?
Yeah. So I feel like, people have maybe a misunderstanding of what pharmacists actually do, whether it's in the retail setting, the clinical setting, any sort of setting. And so when I actually went there myself and saw, what a pharmacist's job consists of, I was like, okay, I really enjoy this. It's a lot more than people think it is. And so I feel like, the pharmacists that I worked with at that time as well had very different, passions. So some of them were in the retail setting, but really liked things that were towards the clinical side, like medication therapy managements and, different things that pharmacists can do within the retail setting. And so just seeing that and observing their day-to-day jobs, their passion for the job was really what, made that connection for me of, okay, this is something that I want to pursue.
How long it took for you to shadow that pharmacist? Days or hours?
Yeah, I actually ended up taking the job there, and I ended up working at Kroger for 6 years. So, but
No,
that,
my question was, Sally, I mean, when you went to shadow, how many hours
yeah,
it took you to make your mind?
I would say it took me about like a month or so to make up my mind.
Okay, okay,
Yeah.
okay.
It might be quicker for some people. It may be, 2 weeks, and you're like, oh, this is exactly what I want to do. But for me, it was about a month of like observation of seeing the flow of how things go and what their roles are for to click for me.
So our advice to parents and potential or students who are interested in the medical field, you want to take your time, right? When you shadow someone, spend time until you see all aspects of the profession or the majority of the day-to-day activity, right? Before deciding yes or no, right? So it took you like 30 days to make your decision because you've seen all the small details that a community pharmacist does.
Exactly, for sure. I would definitely say to take your time in observing and in shadowing, because at the end of the day, this will also, be the rest of your life, and this will be the career that the path you will go down that'll depict the career you end up taking. So definitely take your time, do research as well, see what it's like, what the demand in the fields are that you're looking to, et cetera.
Excellent. So now, Sally, what do you think you've been in pharmacy school. What do you think is the proper background? Should people study business? Should they study biology? Should they study chemistry? What do you think it's a good combination to help them navigate pharmacy school?
Yeah, so honestly, as having a background to get into pharmacy school, I feel like as long as you have your prerequisites, which is going to be majority biology and chemistry, you can have any other background. I feel like for me, biology was most, biology with a minor in chemistry is what I did. And I felt like that was the most beneficial for me. A lot of people might do chemistry with a minor in biology. They really overlap a lot. But I have heard of people honestly doing things like forensic science or having, arts. As long as they have their prereqs, I feel like that is what is most important. You can have a degree in whatever it may be, as long as you have your prerequisites for that college, I feel like is the most important thing.
Right. So maybe a biochemistry, molecular biology, chemistry, a combination of courses in this area, right? So remind us, what are the major prerequisites for pharmacy?
So for pharmacy, when I applied, it was chemistry, Chem 1, Chem 2, Biology 1, Biology 2, Biochem 1, and I think I ended up taking 2 anyways, organic chemistry, your anatomy and physiology. Those are your core basics. It might vary from school to school, depending on where you apply, but I feel like those are the basics.
Excellent, excellent. And probably year 2 and 3 in college, right? And maybe year 4, where you'll be able to get all these prerequisites.
Yep, absolutely.
Excellent, wonderful. So now help us to understand the transition. Now you made your decision, you want to be a pharmacist. How do we get to a pharmacy school?
So getting to pharmacy school, again, I think using your networking skills is extremely important. For me, what my approach was, I scheduled a meeting with the Dean of Admissions just to meet her. And so that she could, when I applied, she could have a face to that application. So even if, I knew a lot of the things that this pharmacy school wanted from me, I also wanted to show my face and make that effort of this is something I really want. So I feel like that's most important, is just to make the effort, show yourself, be seen. In addition to that, really making sure all your prerequisites and your schooling is the best that it can be. Study hard in school, take advantage of that time to prep yourself for your future. So really studying hard in school. And then I started applying, through the Forecast website where you put all your applications in. Letters of recommendation are very important. I feel like my letters of recommendation, the people I chose to write the letters were specifically chosen. So when asking people to write you letters of recommendation, don't just ask them to write you a letter, ask them to write you a strong, would you be willing to write me a strong letter of recommendation? So those are very important because, and pharmacy world is very small. Honestly, the world in and of itself is very small. So you might be applying to a place and they'll see a familiar name. And so they'll ask that person, oh, what do you think of this candidate? and they'll give their opinion. So really being selective in who you ask to write you letters are my biggest tips as well.
So would you recommend people get letters from pharmacists or just from faculty, professors?
Yeah, so for me, I asked my manager, I asked a staff pharmacist that I worked with as well, and then I asked somebody I did research with, and he was a PhD. So I think, if you're applying to pharmacy school, of course you want to ask a pharmacist, and people that you've worked closely with. I think a manager is a good person to ask because they've managed you, they've seen your work ethic, they have a lot to say on how you manage time, what your work ethic is like, your interactions with patients. So they can speak to who you are as a candidate. I think, for me, I also chose the person who I did research with because that's somebody I worked closely with in undergrad. He, observed me being a research assistant as well. And so he had things to say as well. So I think it's good to get a variety, but if you're going to go in a certain field, it's good to get those people. So if you're going to pharmacy school, definitely ask pharmacists that you've worked with to write you letters.
So if I understood you correctly, Sally, you've done research in the undergrad.
Yep.
You've also worked as a pharmacy technician.
Yep.
Right. So obviously the two experience, any other experience you've done beside research and work as a technician in pharmacy?
Yeah. So I think, graduate schools also want to see that you're more than a student. They want to see that you are able to have, extracurriculars as well. So I was able to speak upon my 901 experiences and, being a mentor in that. And that's something I elaborated on as well, that I'm not just a student or a future student pharmacist. I also have, community service activities that I'm part of. And I think that's something, graduate schools love to see as well, is that you're more than just a student and you have a passion for serving your community, whether it's through the medical field or not.
Got it. So basically a combination of showing the admission committee that you are mature, right? Mature, a person with high potential to be a sophisticated and advanced profession, right? Because you are going to a professional school, you're going to become a PharmD, and they want to see maturity, and that can be exerted through your undergrad research, through your extracurricular activity, and showing that you are a young leader, right? And also showing your passion to pharmacy by being active as a pharmacy technician.
Most definitely.
Excellent, wonderful, thank you. So Sally, now walk us through, you applied through the PharmCast. What are the requirements to get into pharmacy schools?
So at my time, you also had to take the PCAT, that's the pharmacy admission test. Okay. UT does not require it anymore, I don't believe, but it just depends on the pharmacy school you are applying to. Some will require you to have your PCAT as well. I feel like that's the majority of it all, is your reference letters, your PCAT, your transcripts sent from your college to the College of Pharmacy, and finally a personal statement. So I can't believe I almost forgot that. Your personal statement is extremely important of why do you want to be a pharmacist? You're applying to the school, you need to know why you are here and what you plan to do for your future. So that's something I spent significant time on, was my personal statement. I had several people read over it, give me their feedback, check for any grammatical errors, or see if, some things could be reworded to sound a little bit better. But those are the big major things for your application.
Excellent. So obviously spending good amount of time on preparing your package, your admission file, right? That goes to the admission committee. And then once you are selected, right, you come for interview.
Oh, yeah.
Tell us more about your personal interview with the College of Pharmacy.
Yeah, so interview day is very nerve-wracking. Looking back on it, you're so nervous. Like, oh my gosh, are they going to like me? Are they going to let me in? But looking back on it in retrospect, when you get to the application, to the interview portion of it, your foot is in the door. It's just, showing your personality, showing who you are to these people. So for me, my interview day consisted, of an introduction, meeting a lot of the faculty, getting to know UT, having a tour, speaking with students, being able to ask questions. And my last portion of the day was the actual interview portion. So in my interview, I met with an amazing pharmacist and one of the faculty members, and then a student pharmacist as well. And so during that process, would ask me questions, pretty straightforward, standard questions. Why do you want to be a pharmacist? Why do you want to come to University of Tennessee? What are your strengths? What are your weaknesses? What is a difficult encounter that you encountered, and how did you walk us through how you approached it? Very standard questions, honestly, to just get a feel for who you are as a candidate and why you want to come here and what you want to pursue. So I feel like, my advice to people during that process is to just, try to be yourself. I know it's very nerve-wracking. It's very difficult to be when you're in that kind of situation. But when you realize, I am here, they want me to some extent, I just need to show who I am and what I have to offer. And I feel like that makes the process a little bit easier.
Exactly right. So obviously you have to do your homework and prepare yourself for the interview, right?
For sure.
And prepare. So you always prepare to answer and give them honest, good answers. So feel comfortable. They feel comfortable. We want Sally to join us and be a pharmacist.
For sure.
Right. So congratulations. So now you got admitted to the College of Pharmacy, University of Tennessee. So I know it's a 4 years program.
As you know.
So walk us through your pharmacy school years. How was it?
So UT is set up to where you have, and this was something I really loved about the program, was you have 2.5 years of didactic, and then that's in classroom. And then your last 1.5 years is on rotation. So actually, putting into work everything that you've learned in didactic portion. So for 2.5 years, you are in the classroom, you have lectures every day during P1 year, and you'll have to refresh my memory with our labs. I think that was just P1 year. Dr. Wasem was my professor for pharmaceutics. And so you'll have your didactic portions. For us, we had cumulative exams. It was every other week you would have an exam on, all your lectures throughout those 2 weeks. So for some people that might sound overwhelming, but for me, it was actually, at first it was a little bit intimidating, but it keeps you on track. So every 2 weeks you are sitting down, you're reviewing everything you've learned in those 2 weeks, and you're being tested on it. And then you're moving on to the next portion. So that was something I really actually think was a plus about UT, was that we had that throughout the year to really keep you on track and keep you going. So after those 2.5 years, and after that didactic is done, you move on to your rotations. So your rotations, you put your, you rank what you would like, and you submit it to the faculty, and then they essentially put it through a system, and it'll, let you know what your rotations are for the next 1.5 years.
So Sally, let me interrupt you for a minute. So let's talk in more details about the first 2.5 years.
Okay.
So what did you learn actually that made you a pharmacist? That basically different than other fields like dentistry or medicine.
Oh, for sure.
So we want to help our viewers to understand what is unique and different about somebody want to do pharmacy that than compared to other fields.
For sure.
Share that view, please.
Yeah. So during those first 2.5 years, you have, so many courses that go through essentially your job as a pharmacist, all the knowledge that you need to move on. So we had courses such as pharmacology, which was, just the basic understanding of medications, their mechanisms, their effects, interactions, etc. You would also have, you'd go into depth more with the chemistry, behind these drugs. That was also another class. We had another class that was pharmaceutics taught by Dr. Mwasset. And that would go into, more as well. I feel like then you would have applied therapeutics courses. And that was really taking all of that knowledge that you've learned about all of these medications and applying it to patients. So let's say we have a patient who has kidney dysfunction and has all of these different comorbidities. How are you as a pharmacist going to manage these patients on these, multitudes of medications? And you have to look at the big picture and then narrow it down. During that time, we would, to make it.
Sorry to interrupt you. Let us help the parents, because I mean, you mentioned a lot of sophisticated information. So let us break it down to our viewers. So the first year, you basically learn the effect of the drug. That's what they call pharmacology. The effect of the drug, right, in the body.
Right.
Right. And then you learn about the chemistry of the drug, and that's called medicinal chemistry. Right. And you learn how changing a minute change in the chemistry of the drug make a huge difference, right, in the efficacy.
For sure.
And sometimes can reverse efficacy, right? So you learn the chemistry. And then in pharmaceutics, you learn about drug delivery and how to design different route of administration, right? So that's what basically makes the pharmacist more knowledgeable about the pharmaceutical compounds, the drugs, and the therapeutic efficacy of them, right? Because that of the pharmacology, medicinal chemistry, and the delivery during the first year, right? And then the next year, second year, what do you learn in the second year?
So in the second year, you are building upon that basic knowledge that you've obtained. So now you know the chemistry behind why this medication is the way it is. Now you know what this medication, what exactly it does. Now you're building upon that and you're applying it. So we had classes such as—
How do you apply it? Share with us, how do you apply it? I mean, what's the format?
So we had courses such as therapeutics. Therapeutics is essentially taking that basic knowledge and you are, putting it into, I guess, a patient case, and you are applying that knowledge. So you would have, we'd go further into depth with like antibiotics and matching a bug with a drug. So this patient has this infection. What can we, what targeted therapy can we use to treat that infection? So it was really going more into depth. In addition to that, we had some throughout the semester, you'd be assigned a hospital or a place of practice, and you would take that and you would have actual patient cases from actual patients, and you'd meet with clinical specialists, you'd meet with, pharmacists in the hospital. They'd give you a patient case and they would tell you, okay, you were to have this patient as a pharmacist, how would you approach their care? What would you do in this situation? So every so often you would come and you'd have to present that patient to the pharmacist, to the residents, to other students. And essentially, we would have a format called a SOAP. So you would have your subjective, which is essentially what did this patient present as? What are we looking at here? Then you'd have the objective. Those are things such as their labs. Then you would go on to your assessment. What is your assessment of how this patient presented, and what would you make of these labs? And then you have your plan, not the plan that was actually done, but what would your plan be as a pharmacist? So, for example, a patient presented with pneumonia. How would you have approached it? And you'd have to really dig down into like the guidelines, look up guidelines and see what is the guideline directed therapy for this patient. How would I have approached it versus what was actually done and why was it done? So it was really, go ahead.
So basically, Sally, you are, although the physician has diagnosed the patient, right? And you're given a history, or you have to ask the patient for the history, and then you have to suggest the medication for that patient.
Absolutely.
You're being trained to not to diagnose, because the physician will do the diagnosis, but you're being asked to select the proper medication, right, for that particular patient.
Absolutely.
And that's basically the function of the pharmacist, is the proper selection, right, of the medication to that particular patient, particularly if you have a difficult case where the patient can have diabetes and hypertension and congestive heart failures and other diseases, right? And you have to manage a cocktail of drugs right? So tell us a bit about these difficult cases.
Yeah, so, very many things can affect your patient care. It can be as simple as their age, and then it can also be their, other disease states that they may have that may completely affect how you are going to approach the patient. So for me, I guess the most fresh on my mind would be pediatrics. That's a whole different patient population. So a lot of people think smaller children, smaller doses. That's not the case at all. Very many things contribute to how you are going to approach your patient. So you need to look at things such as their age, look at their weight, look at what other disease states they may have that might affect their therapy. If I'm looking at somebody who's, for example, on dialysis, how am I going to time their medications? What is going to be absorbed by the dialysis? What do I need to time away from their medications? Things such as this, so many things can affect your patient care. Really looking into the literature onto, a lot of with a lot of your therapies is extremely helpful all the time. I always have guidelines open, really referring to these guidelines, seeing how I'm going to approach patient care.
Absolutely. So you basically learn how to manage the therapy and pick the right doses and the right medication.
Yeah.
So it doesn't cause side effects, right? And other side effects to a patient.
Right.
Because as we know, all medications have side effects, right? Now, pharmacists, we know that very well.
And you want to choose the best, there's always going to be more than one answer. And that's, I think, the difficult thing is there's always going to be one, more than one thing you can use to treat a patient. But what's the best option for my patient? And how will I approach getting the best option for them?
Correct. So now you have the didactic or the academic background in 2.5 years.
Yeah.
Tell us a little bit about the rotation. Do you pick the rotation or they pick the rotation? How long do you spend in the hospital?
Yeah.
Different settings.
So it's a mix of you rank what you would like, and then they try their best to accommodate you and give you what rotations you were interested in. And so you submit this rank list, and then the faculty puts it through what we call a lottery system. And that system does its best to rank what you would like, what rotations you would like, and get you in those rotations. So after you get your schedule, your rotations are about a month long. There are some rotations that are required, and then there's some that, are elective options. So they give you a variety of experiences so that you really see which field of pharmacy you want to go in, because there's so many different options.
So did you pick your rotations in Memphis or did you go outside?
Yeah, so I did all of mine in Memphis except for my international rotation. So I opted to do an international rotation as well in Spain. And that was kind of a similar thing. You had to actually submit applications for your international rotations. And they based your selection off of what we call Dean's points. And that's a collection of your GPA, your leadership, and you have a partner, and then they average your points out, and they will rank you, getting your top choice based off of the people, other people who are competing for that same rotation and what your points are. So I was fortunate to have an international rotation for a brief time. COVID kind of interrupted that, but you have many options. You can do them all in Memphis. You have options because we have 3 campuses at University of Tennessee. You can do some in Nashville. You can do some in Knoxville. And then we also have some Indian reservation rotations. We have a rotation in Alaska. So there are a lot of options and very many avenues you can go down.
That's wonderful. That's great. Wonderful. Did you go to Cordova in Spain?
I didn't. I was actually in Barcelona.
Barcelona, okay.
And we're only there for 12 days, and then they brought us back.
Because of COVID.
Yeah, it was March 2020. So we were there for 12 days. And I remember emailing Dr. Krill, like, do we need to come back? What's going on? She's like, oh, y'all should be fine for now. And then later that night, it was when the president had said, everybody, who's outside of the country needs to come back or they will not be let back in. So they flew us back overnight.
Nice. So we are receiving few questions from our viewers.
Yeah.
One good question, about pharmacy math. How much, can you elaborate how much math is pharmacy in the pharmacy is needed?
Oh, wow. Yes. Math is something that is very important in the pharmacy world. We actually even have a pharmacy math course during our P1 year to ensure that we are, capable of being able to carry out calculations. I think it's a lot more important in my field of pediatrics because everything is weight-based. So math is extremely important, whether it's for peds, whether it's for pharmacokinetics. So, how the drug is affected by our body or how we're affected by the drug. There's a lot of calculations that have to go into how quickly is the drug eliminated from your body? How long does it take to be eliminated? This comes into play when you are monitoring drug levels for certain drugs. So there's some drugs that you have to make sure, is not too much in your body and it's not too little. And there's a lot of math that goes into calculating the appropriate dose for your specific patient.
So I would recommend maybe they at least have calculus 1, right, in college.
Absolutely.
And maybe a little bit of calculus 2, but mainly pre-calculus and calculus.
Absolutely.
It's important for them to understand the equations, right, in the pharmacokinetics area.
Yeah, absolutely.
And how to use them. Excellent, excellent. So, so Sally, the perception people have about pharmacists, they see pharmacists working in the community. So in their mind, pharmacists are community pharmacists.
Yeah.
So tell us, I mean, you are in the field. Tell us about pharmacy. How many different fields in pharmacy do we have?
We have very many. So, a lot of people, I think, as you said, think of retail pharmacy. So that's an avenue you can go down as being in the community was, in a place such as Kroger or Walgreens, CVS, et cetera. And you can work for a chain. Within that, you can also have, independent pharmacies. So that's one big field is the community setting. And that's really you're ensuring, still ensuring appropriate care for your patients, making sure that the prescriptions you are receiving from their primary care, from the ER, et cetera, is still appropriate for your patient, given is it the dose? Is it appropriate for whatever comorbidities you know about these patients, et cetera. You can also go into clinical pharmacy. So that is within the hospital setting. And that's just one big overview of the hospital. Within the hospital, you have many avenues you can go down as well. You can go down the management side of it. You can be, a pharmacy director and be over all of the pharmacists in the hospital. You can also be a staff pharmacist, which is you are in the pharmacy within the hospital and ensuring all the drugs that are coming out of the pharmacy are appropriate, that they're verified appropriately. You can also be a clinical specialist. That's the field I would like to go down. And that's really being with your teams in the hospital. So you are rounding with the physicians, with the nurses, with the dietitians, with the residents, et cetera, and you're ensuring optimal care for your patients. You are making recommendations for those patients in real time. You can also go down the industry route of pharmacy. There's also the nuclear route of pharmacy. You can go down the academic route of pharmacy if you want to come back and be a faculty member and teach. There's endless options. There's so many options you can go down in this career field.
Right. So as you said, you can be a community pharmacist and work in a pharmacy chain, or have your own independent pharmacy. And also you can be a clinical specialist, right, in a hospital setting. And that's what you're pursuing, right? That's what you're pursuing. So let's talk about if somebody want to be a specialist in pharmacy, what's the route they have to follow?
Yeah. So after pharmacy school, if you would like to be a clinical specialist, you would need to obtain a residency. So you would need to apply for, first for your first year. So we call that PGY1, and it stands for postgraduate year 1. And so that application process is essentially, it's kind of like applying to pharmacy school all over again. But in this process, it's not I apply and I got it. It's I apply and now I'm ranking different programs. So you apply to these different programs, and it's a rank, and you match with who you match.
Similar to the medical residency.
Yep, it's exactly. Yeah.
So you apply, and then you have to rely on the matching process.
Exactly.
So it's very highly competitive.
It's highly competitive, and I feel like every year that passes, it gets more and more competitive.
So where did you go for your first PGY1?
So I went to Children's Hospital of the King's Daughters. It's in Norfolk, Virginia, and it was a program that I ended up, pursuing interest in, because there was a lot of pharmacists there who actually went to University of Tennessee as well. So there was a lot of connections to University of Tennessee. They call it Le Bonheur of the East. So it was like going to another Le Bonheur, which was, something that was near and dear to my heart, because I also love Le Bonheur. But it's really good to have multiple options, because as we said, the match is very competitive. You want to apply to as many places as you feel fit as possible, because there's a likelihood you might not match the first time, but thankfully there's multiple rounds in which you can apply to match.
So Sally, if let's say you are in a pharmacy school, how do I prepare for residency? If I'm interested in residency, what do I need to do in pharmacy school to be competitive for residency?
Yeah, I think it's kind of the same guidelines as when you're applying to pharmacy school. So really showing you're more than just a student. Excelling in your classes in pharmacy school is extremely important. Having good grades, but also obtaining as many leadership positions as possible. So for me, I decided to be an ambassador for University of Tennessee, which is taking prospective students on tours, taking their families on tours, answering questions, etc. I also decided to pursue leadership positions with different chair opportunities, volunteer opportunities within pharmacy school as well. So I think it's important to display that you're more than just a student. You have the grades to back yourself up, but you also have a passion for why you want to do this. And finally, research. Research is so important when applying to pharmacy school. What projects did you do to really say that you want to pursue residency? Are you prepared to do that in residency? So they want to see that you're able to be a resident and have those qualifications.
So you mentioned we are getting a question about they like to learn about the post-pharmacy school and the career path that are available, and you touch base with community pharmacy, hospital pharmacy.
Mm-hmm.
What other fields beside the major ones, the community pharmacy and the hospital pharmacy? What other area of practice available?
Yeah, so you can. So if you would also like to go down the business route, that's also actually another option. Throughout pharmacy school, you have the option to additionally obtain your MBA. If you would like to go down the pharmacy administration portion of pharmacy, you can go down nuclear pharmacy, which is dealing with radioactive medications and that process as well. You can go down the what else am I missing? The industry portion of pharmacy, right, into pharmaceutical companies, etc. So there is a plethora of options.
What about FDA, Sally?
Yeah, they need pharmacists there as well.
Right. So the FDA and government, right? That's another avenue for pharmacists to join the FDA and the government.
For sure.
Right. Excellent. So you spent your first year in residency in Virginia, mm-hmm, right? Was it special or general? What was the residency in Virginia?
So my first year was a pediatrics residency. Yeah. It was generally pediatrics. I knew I wanted to do peds, and so I went straight into pediatrics.
Okay, so was it like general peds diseases or was particular diseases? How was it?
Yeah, so it was general pediatrics. You have, again, rotations like you did in pharmacy school. So every month you rotate through different services through the children's hospital. So it's overall peds, but you go to different services. See, for example, the ICU, the pediatric ICU, or the neonatal ICU, the general floors, the hospitalist floors, etc.
Okay. And so this is 1 year, right? 12 months. Mm-hmm. And then do you have to apply for year 2?
Yeah, so it depends what you would like to pursue. So for, my interests, if I wanted to just stop at pediatrics, I could have applied to jobs. I feel like with how competitive it is these days, it was important for me to get a second year just to have that in my back pocket for when applying to jobs. But more importantly was I want to pursue in the future pediatric hematology oncology. So I wanted to subspecialize within my specialty. So I could have applied to pediatric oncology programs, but that specific field may have limited me a little bit. So I did another year in pediatrics with a focus, I let my program know this is what my interest is within pediatrics. So they're giving me all of the exposure and opportunities they can.
Wonderful. So between us, Sally, are you shooting to come back to St. Jude?
Oh, I love St. Jude. I would love to.
You're highly qualified now, right? So to become a oncology pharmacist in peds, right? And specialty. Yeah, wonderful.
For sure.
So tell us about the second year. Where are you now?
Yeah, so second year now, I'm at a new program. I have, there's a lot of programs give you the option of you can stay at our program for a second year if you would like, or you can apply to new programs. I loved my first program, but I wanted to get, another view of what it's like at another program and get more exposure to what my specific interests were. And my program they only had a second year in critical care, and that wasn't my interest. So now fast forward to being at my second year, I, have already started my research project for the year. The year's kind of hit the ground running. As a second year, they expect a lot more from you than a first year. As a first year at this time, you have just graduated pharmacy school. You are a baby new pharmacist, and so you're eased into things. As a second year, you're kind of hitting the ground running. You still have, what we call your preceptors, which is, your pharmacist who's responsible for that service that you are on and that rotation you are on. And they're really kind of guiding you, but they're a little bit more in the background versus when you're first year, they're kind of, still holding your hand through it at the beginning. Whereas when you're a second year, you're expected to perform. You will get feedback. You will get a lot of feedback, but they, kind of give you a little bit more autonomy, I feel.
So my understanding, you are now in Chicago, University of Chicago.
Yes, I'm at University of Chicago, and we have a children's hospital called Comer Children's, and that's where I'm at right now.
Excellent. And when did you start the residency?
I started on July the 6th. My first month was an orientation month. Also during that time, I had to take my law exam. For everybody who does not know, every state you would like to be a licensed pharmacist in, you have to take a law exam for that specific state. And it's very, I would say it's more difficult than your actual pharmacist licensure exam because it's very particular and it goes into all the laws of this particular state. So I took my law exam, had my orientation month. In August, I had my general pediatrics rotation. That was my first rotation where it's, you're on the hospitalist teams. It's your kind of bread and butter of pediatrics, stable patients for the most part. And now this rotation that I'm now on is my hematology oncology rotation.
So this brings me to, so when you finish pharmacy school, there's also a board exam after pharmacy school. So tell us a little bit about the board exam.
Yeah, so you have your NAPLEX, which is your board exam that you are expected to take in order to be a licensed pharmacist. At UT, they gave us a lot of prep courses. So throughout the year, you would take quizzes to make sure that you are keeping up. And it's, a summary of everything essentially you've learned in pharmacy school and ensuring you can apply that and you are ready to be a pharmacist. So it's really important to take your time and study for that exam because you can retake it, but it is extremely expensive to take in the first place. So you don't want to retake it. And it may push behind your licensure process. So you take the NAPLEX, and then you also have to take your law exam for whichever state you are going to practice in initially.
What about after residency? Do you have also to take a subspecialty board exam?
Yeah, so if you would like to be a board certified pharmacist, you also have that exam that you need to take. So I want to be a board certified pediatric pharmacotherapy specialist. So that's called my BCPPS. And I'll have to take an exam to, ensure I am able to be a pharmacy specialist and that I am prepared for that field.
So just to help our viewers, it's 40 years of college, 4 years of professional schools, and then 2 years residency, right? And a lot of board exams before starting your career.
Yeah, and you will be a student for the rest of your life. Being a student never ends because you will constantly have to, keep up to date with all the new literature.
So how do you feel now? I mean, you're close now. You finish this year, you become a specialist pharmacist in pediatric hematology area. What's next for Sally? What's next for Sally?
Next, Sally would like to take a break. But as far as applying for jobs, my next step, after I finish residency would be apply for clinical specialist positions. So because I want to do pediatrics, I'll be applying to children's hospitals and trying to get a clinical specialist position. And then also taking my boards as well for my BCPPS.
Excellent, excellent. So what advice do you have for people who want to get into the pharmacy field? What do you like to tell them? What do you like to share with them?
Yeah, I think it's a very rewarding field. It is, if this wasn't my passion, I would not put myself through 10 years of school. So just ensuring this is really your passion and what you would love to pursue. And then, don't limit yourself. Don't ever tell yourself, no, I can't do it. Don't ever allow yourself to be the reason you didn't pursue something. Let other people tell you no and then prove them wrong and keep going. You know a lot more than you think you know, and just continue to keep an open mind, be a sponge, absorb as much as you can from those around you. Really take mentors and take advice from them. Try to absorb all the knowledge that you can and just continue to absorb the knowledge that you can.
Sally, what about the role of family? How did your family support you and help you? Tell us a little bit.
Yeah, I always say if it wasn't for my mother's du'as, I would not be where I am at all. I will never forget having exam weekends and me being so stressed I could not leave my room to eat lunch or dinner, and my mom bringing me food and bringing me fruits and bringing me tea and making sure I'm okay and making sure I'm up at 4 a.m. to review before an exam. So I would say my family has been the absolute biggest support, and they are the only reason I am where I am was through their love, through their trust, through their support, and just something as simple as their du'as. My dad waking up at Fajr and making du'a for me to make sure I do well during my exam. I think they're the reason I am where I am.
Wonderful, wonderful. So I mean, we need the support. We need the family and friends support, right? Because you went through the experience of college, but professional school is more intense.
Yes.
It's more rigor. It's more intense. So you need a lot of support from family and friends.
Definitely.
And what about time management, Sally? What advice do you have about time management?
Time management is the absolute key. You need to be able to, pharmacy school and even residency is extremely busy. You have to be able to, be a student, and it's okay to have like a personal life and have fun with your friends, but to be able to really balance. For me, I live off of to-do lists. Every day I make a to-do list of everything I need to complete during the day before I will allow myself to have like a break. And that's how I function. You just have to really figure out what works for you and go by that and to stay by that. If you're task driven like I am, form to-do lists. Make sure you're sticking by those to-do lists and completing what you need to complete.
Right. So you have to be organized and you have to prioritize and do your work and study and maintain.
For sure.
Exactly right. So it's very demanding, very demanding.
For sure.
So Sally Mansour, this has been a pleasure having you on Talk with a Professional. We appreciate your virtual visit and your advice to parents and future students of pharmacy.
Thank you so much for having me. I really appreciate it. It's been an honor, and it was so good to see you again.
Thank you. And we look forward to seeing you visit with us here in Memphis.
Of course, of course. Tell everybody at UT I say hello.
Will do. Thank you, Sally. And
Alrighty.
to our viewers, we appreciate your time. Thank you for your effort and time with us. We hope you enjoyed our session today with Sally Mansour. And inshallah, we'll see you next month with a different guest. Assalamu alaikum wa rahmatullahi wa barakatuh.